Before we get to the sort of the meat of the topics today, I'm going to give you an overview on what Cochrane IBD is all about. My disclosures. So the Cochrane collaboration has been around for about 25 years now, and it was named after a Scottish physician named Archie Cochrane, who was really a leader of evidence-based medicine. And he wrote a lot about evidence-based medicine and the utility of clinical trials and clinical trial designs long before it became a kind of an in vogue type of thing to have in medicine. And in 1979, he said, it surely is a great criticism of our profession that we have not organized a critical summary by specialty or subspecialty, adapted periodically, of all relevant randomized controlled trials. So you can see even in the 1970s, he was way ahead of his time. So eventually the Cochrane collaboration was born and has grown exponentially since its early beginnings. And what is Cochrane? It's an international organization that aims to help people make well-informed decisions about healthcare by preparing, maintaining, and promoting the accessibility of systematic reviews of the effects of healthcare interventions. In the early days, Cochrane was they sent out the reviews basically by floppy disks, and I think you'd have a hard time finding a floppy disk or a floppy disk drive these days. The initial reviews actually covered topics related to pregnancy and childbirth. These days, everything's on the internet, of course. There are now over 7,000 reviews in the entire Cochrane library, over 2,400 protocols that eventually will become full reviews, and they really cover all aspects of healthcare. The structure is as you see here. The main editorial unit started in the UK and it remains in the UK. There are now 53 separate Cochrane review groups, and each of them has one particular area of healthcare that it focuses on. There are over 28,000 people in 100 countries that are involved in Cochrane, and at least in the centralized areas for each of these review groups, there is government funding. But by and large, almost all people involved in Cochrane are strictly volunteers. Now, why systematic reviews? I think there are some important advantages to the use of systematic reviews. They allow the reader an efficient way to access the body of research. This certainly saves time for the reader that's required for searching. The critical appraisal is done for the reader, so people who don't necessarily have, say, the expertise or the time to critically appraise individual studies, the appraisal is done for them. It allows people to explore the differences between studies. I think it provides a very reliable basis for decision making. It provides an unbiased selection of relevant information in the interpretation of the results. And this is quite different, say, from a traditional narrative review by an expert like we might see up on the table here, where that's their own opinion and perhaps it's not the most unbiased opinion that you can find. And certainly Cochrane reviews are well cited in organizations preparing healthcare policies as well as planning for future research. Now, our own group has been around for almost since the early days of Cochrane. We now have had over 600 authors contribute to reviews. We have 14 people on the editorial board. We have 82 published reviews and 54 protocols that eventually will become full reviews. And our impact factor, I think, is similar to many major, maybe not the top, but many major GI journals. We also have co-publication agreements, and this is very important. We have agreements with the IBD Journal as well as the American Journal of Gastroenterology, and this allows the publication of more concise versions of Cochrane reviews, which themselves can be a little bit wordy at times. It also provides a wider dissemination to people in clinical practice. And finally, we'll get to today's symposium. So for each sort of mini talk, we have 3 of them, about 15 minutes each. We're going to go over some evidence that comes from the Cochrane Library and elsewhere. We have attached to each of these a case study, which I'll introduce at the beginning of each talk and then come back to at the end. And then for each of these, we have a panel debate and discussion. And we've changed the names of the panelists a few times this week, mostly due to Dr. Sandborn's absence. But you can see the panelists we have up here. Dr. Fagan, Dr. Ruggiero, Dr. Hanau, we're going to invite up, Dr. Singh, and then Bruce Sands as well is at the table and is going to participate in the discussion. And we hope that the panelist discussion is educational, but also perhaps entertaining to get your morning started off right. These are the 3 individual talks. Dr. Sid Singh's going to go first and tell us about the current status and the history of anti-TNF therapy for Crohn's disease. We're going to invite Dr. Hanauer to come up and tell us about vedolizumab as a treatment for Crohn's disease. And then finally, Dr. Fagan will talk about ustekinumab as a treatment for Crohn's disease. And then after each mini talk with the mini sort of panel discussion, we're going to invite you guys, the audience, to come up, and we'll have about 15 or 20-minute audience question and answer period at the end. And we certainly appreciate your participation, and really, if you'd like to challenge our panelists, I think that will provide for some further entertainment this morning for us. Finally, and I think these slides will be available to you, but feel free to get your phone out and take a picture of this. We're always looking for new authors to participate in writing Cochrane Reviews. We're also looking for new peer reviewers to participate in our review process. So our contact information is up here. And as I say, the slides should be available to you, but all of our slides from today's presentation will be on our own Cochrane website at some point in the near future.